do in the laboratory, sir? So how do you analyze which embryo to freeze, and how many days do you freeze that? So
Yes.
how much is it useful for the patient?
Yes, that's very important question, because when they started this procedures like around 20-30 years back, there was no that means concept of freezing. So we are stimulating the patient, so the patient will be under the stimulation, so we are retrieving the oocytes, eggs, then we'll be forming the embryos, we'll be transferring back into the endometrium. So already they are in a lot of stress actually by taking this injections and a lot of things. So when we are transferring back, actually it may also cause there is a less chance of implantation. So they will be having a lot of stress as well as. So this freezing, once this freezing came inside, so what we are doing, we are freezing these embryos. So we are leaving the embryos for at least 1 month or 2 months. So the patient will be, they'll be having a natural cycle. So they will be having not any stress at all. So in that cycle, we will be thawing the embryos back, we will be transferring the embryos. So that added a great advantage. So most of the cycles what we are doing right now is frozen embryo transfers. We are reducing the fresh embryo transfers.
Like how much is the success rate for this frozen embryo transfer, sir?
Both are same only,
Okay.
but that trauma will not be there, emotional, because they are undergoing some sedation, so they are coming back, they have to take some medicines and all, so they'll be having little more trauma in those phase, fresh transfer. But in frozen embryo transfer, they are very normal, so it's like a normal cycle for them, so they'll be having not that stress actually, so that will be aid in little implantation. It will be like around 10 to 15% success rate will be more.
So at what time of period do you usually do the embryo transfer, sir? Like frozen embryo transfer, and
Yes.
in the period of cycle?
Yes. So what they will be doing is actually the patient will come after that means day 2. So the doctor will be analyzing the diagnose how was the endometrium, how is the hormonal levels and all. They will be giving some medicines for that. After 14 to 15 days actually we can see the growth. So if everything is fine, they will be assessing the implantation window. So that time only we need to transfer the embryos, basically on day 5.
So sir, what is genetic testing, sir? So how is it useful in IVF process?
So genetic testing, or else we are otherwise called as PGT. So what is PGT is what we will be doing, we will be injecting. So some patients will be having some genetic anomalies. So we will be doing karyotyping for the patients. We will see so what kind of genetic disorder they have. Some patients will be having some that means they have a history of cystic fibrosis or muscular dystrophy. And other more dislocations are all there. So for these kind of patients, there is a high chance of transmission from mother to or parents to children. So for these kind of cases, we will be doing the normal ICSI procedure. We will be culturing into day 5. On day 5, we will be selecting whichever embryos based on the quality. So like if for example 5 embryos are there, so we can't tell all 5 will not be having that gene. So we have to find out which one is good or which one is not having that particular gene. So we'll be doing this process that is called PGT. We will be retrieving some cells from the that means embryos. We will be doing some analysis and we will come to know which one is euploid and which one is aneuploid. That means that is good or bad. So whichever doesn't have that particular gene, we will be transferring that embryo. So we can avoid completely, the transmission rate will be completely avoidable.
So at finally, what do you want to say to all the patients coming to 49, sir, about 49?
So to each and every one of the patients who is suffering from this infertility, what I would suggest is actually we at 49, we are doing a great job. So we are following many important characteristics like safety. So safety is one of the important thing. We are maintaining the high standard. Then ethics, we are following ethics. We will not be like because everything what we are doing in our labs, it's transparency will be there, so there will be no mismatches, because most of the patients will be having that in the mind. So fear of mismatches. So what if they do something purposefully, what if mismatches can happen. So that is not happening in our 49, that I can assure you completely. Then other than that, we are following ethics. So we are not everything what we are doing is ethical practices only. So I will suggest all of the patients, please come to 49. So we will try to help you. Then in turn we will be getting that happiness as well as.
So thank you so much, sir, for taking your time and explaining all these.
Sure.